Hi, this is Dr. Joannides. I'm the Chief Medical Director at Optimum Re, and this is the Optimum Academy Breast Cancer 101 video number 2, Types of Breast Cancer. So let's get started. So what are the types of breast cancer that we're going to talk about? So ductal carcinoma in situ is a group of abnormal cells restricted to the lining of a duct in the breast, but has not moved outside of that duct. So the lining of the duct has prevented invasion into the surrounding tissue. However, invasive ductal carcinoma shows that cells have spread outside of the duct, and this is the most common type of breast cancer that we see. Invasive lobular carcinoma begins in the lobules of the breast, and then it spreads to the surrounding tissues. A more rare type of breast cancer is called inflammatory breast cancer. It's aggressive and it causes inflammation of the breast. And there's also a disease called Paget's disease of the breast, which begins in the nipple and extends to the nipple area on the surface. So let's look at these types of breast cancer. So on the left at the top, you can see what a normal duct in the breast would look like. So it's lined with cells. If there's intraductal hyperplasia, it means that more cells are produced in that lining of the duct. They kind of pile up. And then in the third picture, the middle picture, shows what happens if you have hyperplasia with even more cells, and the cells start looking a little abnormal or atypical. So we call that intraductal hyperplasia with atypia. To look at the fourth picture, you see that there's actually carcinoma cells in the side of the duct. It's within the lining of the duct, so we call it in situ. It hasn't invaded. But then the picture to the far right at the top shows what happens when the cells actually invade through the duct, and that's called invasive ductal cancer. At the bottom, I've also shown a picture of the breast, which also shows the lobules in the breast. So you can consider both where the lobules are and then how the duct from the lobules to the nipple are also involved in ductal carcinoma. So there's two types of carcinoma that we're going to talk about here. Invasive lobular carcinoma that starts in the lobules, and invasive ductal cancer that starts in the ducts. Now, one of the things I wanted to mention, because when you're underwriting, and this is actually a page from the Optimum Underwriting Guide, that there are different types of ductal carcinoma in situ. Some of them are not worrisome, like low grade, grade 1. However, there are some that are more concerning, and especially if you see the word comedo, C-O-M-E-D-O, that's an unfavorable situation. So those are the ones we worry about. Most ductal breast cancers, ductal carcinoma in situ are not worrisome, but if you see the word comedo, that is more worrisome. So I wanted to bring your attention to that. And you can see in the green box, I blocked out what our actual rating is, since not everyone that views this may have access to our guide. So these are the different types of ductal carcinoma in situ. So the reason I wanted to show the picture here is the comedo type is located to the far left on top, and it kind of looks like almost a necrotic area in the center of that purple circle, if you see what I'm talking about. And then there's the other types, cribriform, solid, papillary, mixed. And then just to show you how, sometimes things in the body have a similar appearance. That Comedo picture to the far left at the top has that necrotic or funky looking center, correct? And what I did was I put a TB caseous granuloma over to the far right picture to show you that, you know, things can look similar but be completely different. So that's a picture of a caseous granuloma in tuberculosis, but you get the same idea. It's kind of a cheesy looking center. So that's kind of what comedo ductal carcinoma looks like as well. So I wanted to make a specific point about atypical lobular hyperplasia and lobular carcinoma in situ, abbreviated LCIS. There has been a change in perspective on this. It's not considered a pre-malignant lesion. It's more like an indicator that, you know, something is not right, but only about 50% of surgeons will remove anything that's atypical lobular hyperplasia or lobular carcinoma in situ, and the other half will not remove it since it's not considered a pre-malignant lesion any longer. So there's still some variance, probably depends on who the patient or applicant goes to for their treatment. But many surgeons will just observe and use screening tests to follow any areas. Say it's been biopsied, a questionable area has been biopsied in the breast. A marker will be left there, and then surgeons may just follow that area but not remove a portion of the breast, even if lobular carcinoma in situ is present. So this is a change from the past. However, if the lobular carcinoma in situ is florid or called pleomorphic, high grade with central necrosis, then it should be considered in situ cancer and treated similar to DCIS and removed. I also wanted to mention that Paget's disease of the nipple, so we don't forget about it, should also be considered in situ carcinoma of the breast. So if you see that mentioned, that should be considered carcinoma in situ. We're going to talk a little bit more about that. So getting back to this lobular in situ and invasive cancer. So what's the story on this? So the lobules are pictured here in the picture to the left. A normal lobule, a lobular carcinoma in situ, so there's cells within the lobule, but they haven't broken through, and then invasive lobular carcinoma. So you may wonder, why don't you remove the lobular carcinoma in situ? That looks kind of worrisome, but as I said, it's more of a marker and not definitely a pre-malignant lesion that's going to move into lobular carcinoma that's invasive. So just one of these interesting facts of how the progression of disease may or may not occur. And then to the right, another picture of lobules in the breast, and you can see the difference between in situ, where the cells stay within the lobule, or invasive disease, where they go outside of the lobule. And here we have one more picture just to emphasize the difference, whether the cancer cells in ductal carcinoma stay within the duct, and it's called ductal carcinoma in situ, or they go outside the duct and they become invasive ductal carcinoma, which is the most common type of breast cancer. Then this inflammatory breast cancer that I mentioned, you can see in this picture how red and inflamed the breast appears. So there's tremendous amount of inflammation going on because of the cancer, and this is usually aggressive and very worrisome. But you get the idea that it's a definite change that's apparent on the exterior of the breast. And then to complete the story, Wanted to mention Paget's disease of the breast. It involves the nipple and areola of the breast. Now, there also may be DCIS, or ductal carcinoma in situ, present, or even invasive cancer also present. But on rare occasion, that's with Paget's disease of the nipple. But on rare occasions, only Paget's disease of the nipple is present. So just the nipple is involved. And that's called pure Paget's disease. And you can see on the picture on the bottom to the right that in this case there was underlying ductal carcinoma in situ, and then the Paget's disease was also present around the nipple surface as well. So that's the way that most Paget's disease of the breast is. It's involved with ductal carcinoma in situ or invasive carcinoma, pardon me, but it may be present as pure Paget's disease as well. And then just to complete the picture, when one of these types of cancer may be found, a sentinel lymph node biopsy may be performed. And I just wanted to put this in as the last slide, not that it fits in the different, quote, types of breast cancer, but so I didn't forget it, that to make sure that you're knowing how extensive the disease is in the lymphatic tissue surrounding the breast, sentinel node biopsies are done to try to find out if there's any nodes involved in the axilla, the armpit. So studies are done to try to find out if that area is involved. And so if you see reports of sentinel lymph node biopsy, that's exactly what they're talking about.